can't get the 20% discount from pre-tax income for buying health insurance that I would get if I worked for Raytheon. That's unfair. That's a simple fix, just like that. You open up the market, it's portable, people bring their insurance, they can go wherever they want. It's huge competition. It would put great pressures on insurance costs and drive down the cost of insurance. There's a lot of mandated benefits, chiropractic care, wigs, acupuncture, and health insurance that you may not want to pay for. I can't lambaste Dashiell and Ezekiel Emanuel anymore, I'm sorry. All right. This is the GM. I don't need this slide anymore. This is the GM takeover. Obama famously said, I don't want to run the auto companies. And then within a few months, he was saying that every car had to have 35.5 miles per gallon. And then within a few days, he was saying to people who were about to lose their jobs as dealers closed and factories closed when he took over the auto insurance. I know that what you're doing is making a sacrifice for the next generation. It's a sacrifice you may not have chose to make, but a sacrifice you were nevertheless called to make by me. Thank you for sacrificing. Well, not really thank you, just go sacrifice. It's good for the state. That's collectivism in a nutshell. Sacrifice for the good of the state and the arrogant elite power structure. Now, this is where doctors get penalized. And this is in Section 3001 and Section 3007 of the recently passed bill. The patient, this is the oxymoron, the patient, what did they call it? The Patient Quality and Affordable Health Care Act, or whatever. It's just like everything's a contradiction in everything they say. It's not affordable, it's not coverage, it's not quality. All right? In it, it says the Secretary of Health and Human Services will be given the same powers that a monarch will be given. They shall decide what the quality and efficiency measures are. They shall decide what the penalties are if the doctors don't comply with the so-called best practices, and I'll give you some examples. They shall decide which doctors get to participate. When you read through it, the Secretary of Health and Human Services is granted some 2,000 new powers. A person. This is not the rule of law. This is the rule of man. We overthrew monarchs so we could live under the rule of law, where the law applied equally to everyone. And you didn't have to beg and have political pull with the monarch to get things that you wanted. But now organized medical societies are all having to beg and scratch so that they can avoid a 2% cut here and a 1% cut here, and everyone's playing the game now. So here's how it works. There will be a budget. There will be a single pile of money sitting in the center for everyone to scrap over. This is the amount of money available for your medical care for an episode of care. Heart attack, this is how much money we had to spend on your heart attack. Okay, here's the players. We have the congressmen and the politicians. Hoorah, I just helped everyone. Okay, here's the doctor. Here's the poor patient. Here's the insurance company executive. Here's that limited budget pile of money. A global budget. A global budget. That's a key term you're going to hear over and over. If the doctor decides to take, well, the doctor gets paid out of this, okay? And then the doctor spends money on you too, okay? Now, what happens if you need more money spent on you than the global budget allows? Well, the doctor usually is going to do the right thing and spend the money on you. At least that's how it works now under the Hippocratic Oath, which also Zeke Emanuel says is the core of our problem in medicine. Too many doctors believe in the Hippocratic Oath. That's written in his book, all right? Healthcare Guaranteed for All, I think is the title. All right? If the doctor spends too much money, well, doc, that hurts the system. That hurts the state. All right, so what happens? The insurance company except comes over here and hits that doctor over the head and says 5% penalty. Or what they really say is you don't get the 5% incentive that you should have gotten because you were inefficient. You spent too much money on the patient. We're going to withhold the incentive. That's not a reward system, that's a penalty system. That's a punishment system. And when that doctor goes and says, please, Mr. Congressman, please help, well, that doctor can forget it because we know who's paying the congressman. We know who's keeping them in office. It's those big corporations. Okay? And you know what you call this? You call this medical fascism. It is an economy created where corporations are the agents of the state, which is basically the economic definition of fascism. Fascism is not all those terrible things associated with Hitler. Fascism is an economic model. And this is medical fascism. You can look at my article, Medical Freedom or Medical Fascism at Campaign for Liberty, where I detail that more. Now, here's an example of how this affected me. United Healthcare has a system where I can get 1-star or 2-star. I get 1 star for practicing quality medicine according to what they deem as quality. I got the 1 star. I get 2 stars if I'm cheap or efficient, all right? They decided that I should allow no more than $17,000 to be spent on my patient's delicate spine surgery of the neck to treat their arm pain. I should allow no more than $17,000, a portion of which will go to my pocket, a portion of which will go to the hospital, a portion of which will buy the plate, a portion of which will put you in the ICU, buy the MRI, do the physical therapy, do all the things you need to get better for actually 6 months total, $17,000. Now, of 7 patients, a statistically non-valid number to do a rating on, of 7 patients, 3 of my patients had $22,000 spent on them. It didn't go in my pocket. That went to MRIs and physical therapy. I didn't even order most of the stuff. Other doctors did, but I was dinged. I was the anchor doctor because I did the surgery. So what did they do? They said, "Doctor, shame on you. We're not listing your name in our book anymore. We're going to tell patients that if they go see other doctors, they're going to have to spend less out of pocket. We're going to tell other doctors that if they send to you, we're going to give them other doctors, they send to another doctor, we're going to give them an incentive payment, and we're going to make your staff spend hours on the phone getting an approval for an MRI. In fact, we're going to make you talk to a pediatrician in Tennessee to get approval for a spine operation next time." Well, I can't survive economically under that system, and also ethically I can't survive under that system, so I dropped them, okay? I don't take patients with United HMO. I take United PPO, and then we have a little agreement about how much you're going to pay me over what United will pay you, and we have to go through that little thing, but actually it's been good for all. Because now I get to practice medicine the way I want to practice, and it turns out the patients are surprised to hear that it's only going to cost them an extra $250, $300 out of their pocket to see me. You know, a lot of patients think that to do the spine surgery, I'm going to walk away with $40,000, $50,000, $100,000. $2,000, $3,000, $4,000. Okay? That's what I get paid. You'll pay more to fix your transmission. Okay? So, I'll quit medicine before I do that, and I quit that program. Here's some good examples of things that screwed up patients. All right? They're going to incentivize you, in other words, penalize you if you don't comply, with stopping antibiotics 24 hours after surgery, with not using a razor to shave the skin, with using the committee-approved cheapest heart medicine for heart failure, with making sure that antibiotics are given within 4 hours of pneumonia, even if it means you give antibiotics to people who actually have congestive heart failure. Okay? There's a great one I haven't put up here called the beta blocker rule for people who come in with heart attacks. They wanted everyone within 24 hours to get a beta blocker for their heart attack. It's good sense, good medicine for most patients if you're a good doctor and know how to do it right. Well, what happened? The hospitals have all these forms, they have all these committees, they have all these compliance people. Everyone got the drug. And what happened? People died. People went into shock because they gave it to heart failure patients. In fact, this was published in the year 2005, again in Lancet, that you shouldn't give beta blockers to certain patients with heart attacks because they will go into shock. All right? It was published the same year they initiated the performance measure. It took them 4 years to retire the measure. How many people died complying and getting a good report card and a bonus because they thought they knew how to practice medicine better than the doctor seeing the patient? That's pay for performance. That's penalties for physicians and patients. So what happens when you have these incentives? Well, I'm going to not see sick patients. If I'm going to get a penalty when I spend too much money on my patient, I'm not going to take the patients that are going to make me have to spend a lot of money on them. That doesn't help people. This is well documented in the literature. Doctors actually do this. They avoid sick patients. Let me ignore that.